Hi, this is Samantha, one of the dental hygienists at Pear Tree Dentistry in the greater Portland area. I'm here to educate patients who are or will be going through chemo or radiation treatments. The care of our cancer patients is something we feel very passionately about here at Pear Tree Dentistry. Statistics show that 1 out of 3 Americans will be diagnosed with cancer in their lifetime. All of us at our office have been affected by cancer on a personal note, with either experiencing cancer firsthand or through a loved one. We want to educate our cancer patients about oral care to minimize treatment complications. Please share this video if you know someone who could benefit from it. No surprise here, but the body is interconnected. The mouth has an effect on the rest of the body. Many studies have proven that periodontal disease, or more commonly known as gum disease, affects the whole body. Periodontal disease can cause higher levels of C-reactive proteins, or inflammatory proteins in the blood, increasing cardiovascular disease risk. In women, it increases risk for premature or low birth weight babies. In elderly populations, periodontal disease has been linked to lung infections. Our goal for you is to ensure prior to cancer treatments that your mouth is in the best possible health to minimize cancer treatment complications. Studies have shown approximately 75 to 80% of chemotherapy patients experience clinically significant oral mucositis. This may present in your mouth as little sores. They can range from asymptomatic to painful. Almost all of head and neck radiation patients experience oral mucositis. 66% of those patients experience severe oral mucositis. Pain in your mouth can cause treatment complications, such as dehydration or infection. We have so many great dental products that help alleviate pain, hasten healing, and reduce the risk of secondary infection for you. We focus your dental treatment in 3 phases: pre-treatment, treatment, and post-treatment. Your pre-treatment visit is prior to initiating any cancer interventions. The treatment visit is throughout your oncology appointments and your post-treatment care as a cancer survivor. Your pre-treatment visit is the most important appointment. It is critical that you receive complete oral care prior to initiating chemotherapy or radiation. There are certainly some circumstances that this is not possible to do prior to treatments, and that's okay. We're flexible and we work closely with the treating oncology team to ensure you receive the best possible care. We ensure that a recent full set of x-rays has been taken to evaluate for wisdom teeth, check existing restorations and root canals, and to check for any infections. We perform a thorough oral analysis. We rule out infection and address any areas that we feel may pose a risk of cancer treatment complications. Rather than complicating your life and the lives of the treating oncology and radiology team, we'd prefer to minimize invasive dental treatments during cancer treatments. Cancer patients often experience an increase in healing time and an increased risk of post-op complications following dental treatments while undergoing cancer treatment. We want to reduce your risk of possible osteoradionecrosis of the jaw. Blood counts are typically not a concern prior to treatments. We want to eliminate any discomfort that you might experience. For instance, we would prefer to avoid working on your mouth if you were having a bout of mouth sores. Radiation to the head and neck can cause permanent dry mouth known as xerostomia. Most chemotherapy drugs cause temporary xerostomia, and your saliva flow will return to your normal baseline after you are through with your treatments. Xerostomia is a risk factor for cavities. Saliva is protective to the teeth, and in a healthy mouth, constantly bathes the teeth in minerals, enzymes, lubricates, and helps to neutralize the pH of the oral cavity. During the pre-treatment appointment, we may recommend that fluoride trays with a concentrated sodium fluoride gel, like Prevident, be worn daily. A fluoride varnish treatment may be applied for cavity protection. Varnish has a pleasant taste and, more importantly, has been shown to stay on the teeth for up to a month after brushing and flossing. Our hygienists extensively review a packet for cancer patients and tailor the information to your specific needs and what type of cancer treatment you will be receiving. Every patient is different. It's important for us to adapt treatments to you specifically. For instance, I've had a patient who did not have the manual dexterity to floss, so we were able to adapt and find a way that he could clean in between his teeth easily. We educate about oral home care, xerostomia, diet, sugar and pH balance of the mouth, xylitol sugar, how to handle vomiting in your teeth, and much more. Each one of our cancer patients leaves the office with a laminated, customized oral hygiene regimen specific to that patient to simplify oral care at home. We know that oftentimes you may have several medications to juggle at different times during the day. We want something straightforward and easy for you to manage. So here's an example of one of our patients who underwent head and neck radiation and chemotherapy. We created this custom oral hygiene regimen for at-home care to keep our patient as comfortable as possible. There are several reasons that it's important to treat dry mouth. It increases one's risk of developing cavities. Xerostomia can be quite uncomfortable. It can affect swallowing and cause altered taste. You may see in your own mouth your tissues can appear dry and glossy to varying degrees. This photograph is on the more extreme spectrum of dry mouth. So lastly, it's important to treat and improve your quality of life and protect your teeth. Now that we've established how important it is to treat your dry mouth, here are some great options to protect the teeth and provide relief. A product called MI Paste is one of our favorites. It contains casein, calcium phosphate, and fluoride. This product provides you with essential minerals to protect teeth, and the casein protein aids with sticking the product to the teeth and tissues. Patients find the taste to be pleasant and mild. The creamy consistency helps to coat and soothe the mouth. You should not use this product if you have a true milk allergy due to casein. If you are lactose intolerant, this product is safe for you. Another option for dry mouth is Saley's lozenges. These are gelatinous mints that stay in the mouth for several hours. Saley's contain baking soda, xylitol, and ACP. These lozenges help shift the oral pH to favor a more alkaline environment, protect the teeth, and provide hours of dry mouth relief. You can easily buy these from a pharmacy or online. Saley's are available in wintergreen, peppermint, and mild lemon. I've actually clocked a mint in my mouth for over 2 hours. These provide excellent dry mouth relief and teeth protection. Many people are becoming more familiar with xylitol. For those of you who have not heard of it, xylitol is a safe, naturally occurring sugar alcohol found in fruits and vegetables. It is mass-produced from birch trees. One huge benefit of xylitol is it is safe for diabetics and it does not cause a spike in blood glucose levels. If a therapeutic dose of xylitol is consumed daily, has to be at least 6 grams, it helps in decay prevention and can even reverse the first stage of a cavity. The bacteria primarily responsible for causing cavities attempt to metabolize xylitol, and it causes the cell to lyse or to burst. Xylitol encourages the reuptake of minerals into the tooth. And it is worth mentioning that if you have a dog at home, even small amounts of this sugar can be dangerous for your pet. Do not leave any products that contain xylitol in accessible areas to dogs. There are so many different ways to get xylitol. You can use granulated xylitol. It's heat safe, so you can cook with it. I love to recommend this to my patients who enjoy sipping tea or coffee throughout the day. Xylitol comes in gum form. You can buy it online or commercially. One piece of advice when looking at what xylitol gum to purchase is where xylitol falls in the ingredients list. There are several gums out there now that have minuscule amounts of xylitol, to the point where you would need to consume a whole pack of gum to reach the therapeutic dose of 6 grams. One gum available almost anywhere is Ice Cubes gum by Icebreakers. Each cube contains 1.2 grams of sugar. I often tell my patients to double up on the cubes, so if they chew around 6 cubes a day, they are giving their teeth that great protection of xylitol. A company called Dr. John's has a whole line of delicious xylitol products, ranging from lollipops to hard candies, taffies, chocolates, and mints. I will admit I have sampled quite a few of their candies, and they are delicious. Several of my oncology patients really enjoy their peppermint hard candies, since peppermint is soothing to an upset stomach. Biotin is a mild, alcohol-free mouth rinse to help provide you with dry mouth relief. Biotin products contain some of the natural enzymes found in saliva and xylitol. Biotin makes a whole line of Xerostomia products. This product comes in convenient small containers for artificial saliva, so it's easy to carry in your purse or your pant pocket. A healthy mouth has a pH of around 7.2. When the pH of the mouth drops to 6.8, the detrimental bacteria start to flourish, and many of the protective oral species begin to die off. At a pH of 5.5, the enamel on the tooth begins to break down, making the tooth less resistant to decay. Many factors play a role in the pH balance, such as diet, frequent vomiting episodes, GERD, and reduction of saliva. To help combat an acidic environment, we recommend the use of baking soda toothpaste, lozenges with baking soda, like the Salies I mentioned a few slides ago, and rinsing with 8 ounces of warm water to 1 teaspoon of baking soda. It is slightly counterintuitive. If you're experiencing significant vomiting episodes, do not brush immediately after vomiting. After vomiting, stomach acids are in the mouth, and they weaken the outer layer of the tooth. If you brush at this weak stage, the enamel or the outer layer can lose microscopic layers. If this happened a few times, it's not a big deal, but if you made a habit of this, it could lead to problems for your teeth. Instead, swish and expectorate with baking soda and water if you can tolerate it. If the salty taste is unsettling to your stomach, a flavored sodium fluoride rinse, like ACT from the drugstore, can be used. Wait 30 minutes after swishing with the above before brushing. Another misconception is that if you have dry mouth, a lemon will stimulate saliva flow. You may have a very slight and temporary increase in saliva, but the acid from the lemon is going to do damage. Lemon has a pH of 2.0. To give you an example, concentrated sulfuric acid is 1.0. So I'd really discourage this. There are better options available to treat dry mouth. So the dental golden rule, it's not the amount of sugar a patient consumes, it's the frequency. The bacteria that are responsible for decay have no sugar reserve. They must metabolize what sugar is available in the mouth. As a byproduct of metabolization, the bacteria produce lactic acid. This acid erodes at the enamel and can eventually cause a cavitation in the tooth. We encourage you to substitute gums, mints, and candies with xylitol or sugar-free options. Be really careful of liquids. Sodas and juices can contain massive amounts of sugar. Sipping on these beverages throughout a morning or an afternoon will likely lead to dental problems. Instead, sip on tap water or bottled water with a pinch of baking soda. Bottled water can actually be on the acidic side to give it a longer shelf life and for improved flavor. Drink sodas with a meal or snack consumption, as the body will naturally produce more saliva, which will help neutralize the oral pH. During treatment, we want to see you every 3 months for cleaning appointments and a fluoride application. As a general rule, if the platelet count is less than 50,000, or if the white cell count is less than 2,000, we will consult with a treating oncologist before commencing treatment. Even if your counts are below the above numbers, we will still perform a visual oral exam and take necessary radiographs. We also frequently see patients who are experiencing oral chemotherapy or radiation-induced complications such as sores or thrush. In instances when patients are in pain, we check for secondary infection and, if necessary, prescribe magic mouth rinse to provide relief and comfort. We often recommend Gum's alcohol-free chlorhexidine gluconate rinse. It helps to expedite tissue healing. Understandably, a common concern for our cancer patients is additional radiation from dental x-rays during treatment. We want to assure you, digital radiography is very low radiation. One x-ray is equivalent to 5 conventional dental x-rays. We always aim for the lowest dose of radiation, and we never take an x-ray that we do not feel is medically necessary. This is actually a picture of my 2 boys on a beach in Casco Bay. But we really do have a special place in our hearts for our cancer patients. We want to make sure that you know we're here, cheering you on to the finish line of your oncology treatments. We are attentive to your specialized needs as a cancer survivor. Post-treatment, we will continue to monitor you for possible long-term xerostomia. We perform a thorough head and neck oral cancer exam with palpation, screening, and Velscope technology. The Velscope is a new technology that involves no radiation and can detect cell dysplasia, the stage before cancer. We do not charge for this screening light. We feel that is an important part of the exam. It is important for every patient, and we didn't want people to opt out of this due to financial constraints. This light allows us to check things that we cannot see with the naked eye and catch suspicious areas early. In head and neck radiation patients and patients who have received bisphosphonate treatments, we closely monitor for osteoradionecrosis of the jaw. We see survivors for routine dental care. A few helpful tips here. Unless medically necessary, do not consume sugar-containing candies or gums. Avoid cinnamon gums, candies, mints, or paste, as cinnamon is harsh even on healthy tissues. And never use alcohol-containing mouth rinses. These include Listerine with alcohol, some Crest rinses, and others. Check the label before purchasing. Alcohol will sting while rinsing if mouth sores are present and can delay healing. From all of us at Pear Tree Dentistry, we want to wish you the best luck throughout your treatments. Please call us with any questions or concerns. Thank you.